Your fingernails, they can tell more about you than you realize. Their condition can signal many things about your overall health. Well, joining me now is Dr. Cohen, a board-certified dermatologist from About Skin Dermatology. And thank you for joining us today, Dr. Cohen. First of all, what signs can you get from your nails that something could be wrong?
Well, when most of us think of nails, we actually think, just as my 7-year-old daughter does, what color is our nail polish? But underneath all of that, actually, the nails can signify many different diseases, from systemic diseases, as in this case. This is kidney disease, and this is called half and half nail, where the end of the nail is dark and the beginning part of the nail is very light. And this is extremely specific for kidney disease. But there's other widespread diseases in the body that actually can have nail specific features, and those features can be seen very specific, or they could be non-specific features.
Talk about nail infections, because I understand that they are actually the most common issue that people have.
Yes, nail infections are very common. Traditionally, we think of fungal infections and processes like that, where the nails have a little yellowish discoloration and a lot of debris, and the nail can separate from the overall bed beneath it. But sometimes nail infections include warts or herpetic infections, and sometimes bacterial infections, particularly people who work with their hands, get their hands wet, and are subject to trauma like bartenders can get staph infections called paronychia.
Skin cancer is also an issue, right, that can affect the nails?
Yes, as the skin is really a manifestation of, and the nails are really a manifestation of the skin, and thickened keratin. Melanoma, as in this picture, is something that can occur. Melanoma is the most deadly form of skin cancer, and in the nail, sometimes there's a delay in diagnosis. People think that the pigment can sometimes be a bruise, but it's important, as you saw in that picture, that oftentimes in melanoma, the pigment extends to the skin around the nail itself.
Interesting. All right, so bottom line then, give us some tips then how to keep our nails healthy.
So usually appropriate and good nutrition, as most of us have, can keep the nails healthy. For people who have brittle nails, supplements like biotin are important. It's important to clean underneath your nails before eating and before surgical procedures or taking care of wounds. And it's essential to remove nail polish before you go to a physician's office, whether it's a dermatologist, your primary physician, because as we discussed, nails can be really a sign of something going on widespread within the body.
Yeah, great idea. I hadn't even thought about that. All right, great. Thank you so much, Dr. Cohen. Appreciate it.
My pleasure.